Hello, today is Wednesday, February 16th, 2022. Today's topic for my daily English reading is How Long Should Sex Really Last by Healthline.com. Medically reviewed by Janet Brito, PhD, LCSW, CST, written by Adrian Santos Longhurst on January 28th, 2019. So overview, sex varies, needs vary, biology, how to make it a quickie, how to prolong your sex sesh, takeaway. What's the average duration? Vaginal sex therapies typically lasts 3 to 7 minutes according to 2005 Society for Sex Therapy and Research member survey. According to the survey, vaginal sex that lasts 1 to 2 minutes is too short. Vaginal sex that lasts 10 to 30 minutes is considered too long. So how long should vaginal sex actually last? The sex therapists surveyed say that anywhere from 7 to 30 minutes is desirable. 7 to 30 minutes. It's important to note that these figures only apply to penile vaginal intercourse. They don't account for things like foreplay, and they aren't representative of other types of sex. It primarily depends on how you define sex. Most studies of this nature are based on intravaginal ejaculatory latency time, IELT. Sounds like an English test name by the UK. Intravaginal ejaculatory latency time. IELT refers to the time it takes a person with a penis to ejaculate during vaginal penetration. But this isn't how everyone defines sex. Many people consider the end of sex to be once all involved parties have climaxed. This may be achieved through touching, oral sex, vaginal sex, anal sex, or a combination. If intercourse is the only component in your definition of sex, then sex will likely only last a few minutes. It's also worth noting that using IELT as a baseline assumes that penile vaginal intercourse is the standard. Vaginal sex doesn't always involve a partner who has penis. And although it's possible to extrapolate these figures to penile anal intercourse, vaginal and anal sex aren't the same thing. Research is needed to determine the average and desired duration for these encounters. What you want out of an encounter is also important. Sex should be pleasurable over anything else, and this comes down to personal preference. Some people want a long, sensual encounter, while others want something fast and aggressive. The key is that you are having satisfying sex as opposed to beating the clock. All that said, you can't fight biology. In some cases, underlying biological factors may affect how long your sexual activities last. Age. As you get older, you may find that it takes longer to become aroused. Erections are more difficult to achieve and maintain. Hormonal changes contribute to things like vaginal dryness and decreased libido. Genitalia. The shape of your genitals may also be a factor. Researchers in one 2003 study found that the shape of the penis, especially the ridge around the head, may have evolved to be more competitive. The ridge is able to displace any pre-existing semen in the vagina. Deeper and more vigorous thrusting results in more semen displacement. This allows the ejaculation partner to make room for their own semen, increasing their chance of reproduction. Using competitive evolution as a backdrop, this could explain why some people find it painful to keep thrusting after ejaculation. Continuing to thrust may displace your own semen and decrease your chance of reproduce. Sexual dysfunction. Premature ejaculation, for example, can cause you to climax faster than you may prefer. People with delayed ejaculation may take longer to climax if they are able to at all. If you want shorter encounters, if a quickie is all you want, these techniques may help you get there faster. Touch yourself. If you are short on time, masturbation can be a great way to ensure that you achieve the big O. After all, you know your body best. Oh, big O. If your partner is already touching you, explore a different area. You can rub your clitoris, gently pinch or pull your nipples, gyrate your hips, smack your behind, gyrate your hips, gently pinch or pull your nipples, rub your clitoris. You can enjoy mutual masturbation in which you each pleasure yourselves. This gives you both the opportunity to climax faster while still being intimate. Tell your partner what you want. Communicating your desires to your partner and vice versa can help you both understand what it takes to make each other orgasm. You can utilize what you learn to get the finish line faster for mutually satisfying quickies. Try climax-inducing positions. If you know that certain positions feel better for you than others, shift as needed to get yourself there faster. This can include positions that encourage deeper penetration or those that make it easier for you to mutually pleasure yourself or your partner at the same time. If you want longer encounters, if you want to prolong your sexploration, these techniques may help. Want longer encounters? If you want to prolong your sexploration, these techniques may help. Siemens stop-start technique, also known as edging, this involves temporarily stopping all sexual stimulation when you feel like you are close to ejaculation. You and your partner can resume your activity once this feeling has passed. Although this technique was originally founded to help a person who has penis delay ejaculation, it can be used by anyone looking to prolong climax. Johnson's and Master's squeeze technique. This technique entails gently squeezing the end of penis for several seconds just before ejaculation until the urge subsides. It can also be used to practice ejaculatory control. Urge subsides. It can also be used to practice ejaculatory control. The bottom line, the definition of what sex is, individual expectations, and mutual desires all influence how long sex may last. If you are concerned about how long you are able to have sex, consider making an appointment with a doctor or another healthcare professional. They can discuss how you are feeling, answer your questions you have, and assess any underlying symptoms or other discomfort. Last medically reviewed on January 28th, 2019, so it's a relatively recent article. So we learned the Johns and Master squeeze technique. So we squeeze the end of the penis. Okay, our practice. Siemens start technique, known as edging, all stopping all sexual stimulation. That's good. So thanks for listening. Bye bye.